Hi, everyone. My name is Dr. Lawrence Nguyen here at Vance Thompson Vision in Omaha, Nebraska. As an optometrist that has cataract conversations with patients on a day-to-day basis, one of the most important and valuable topics that I can have with the patient is how they want to utilize their vision after cataract surgery. How people spend their day-to-day lives, whether it's with their hobbies or occupations, really does change the narrative as far as what implant technologies I'd recommend for them at the time of cataract surgery. Now, one important element to consider is obviously the health of their eyes and what they're going to be a suitable candidate for. But then what drives the conversation even further is just what their goals and motivations are as far as just where they're going to be after cataract surgery and what they plan to do on a day-to-day basis. Now, flipping that script around, let's say someone were to tell me that I had cataracts today and that I need to go through cataract surgery. One of the things that I'm going to be looking at is just what I do on a day-to-day basis. And as an optometrist that's constantly having face-to-face interactions with patients, I really do value having eye contact and being able to see patient expressions. And so that distance vision is important for me. But I'm also looking at diagnostic scans, reading charts, and being in front of my computer a good majority of my day as well. And so that captures a lot of intermediate range. But then I'm also, of course, like any millennial, on my phone a lot and checking my watch. And so really, I capture a lot of distance, mid-range, and up-close activities on a frequent basis for my average workday. Aside from work, I love being outdoors, I love being active, and when I start to think about each of those activities, whether it's outside of work or at work, I want to be able to do those activities without glasses. And so if someone were to tell me, hey, what lens option would you choose for yourself if it were your eyes? I do think I would like to choose the multifocal lens. I think the multifocal is probably one of the more advanced technologies that's available that can help correct all three functional ranges and give a diverse dynamic range for somebody to live life without glasses. And for me, I think that's something that I would prioritize. And so that's something I'd want for myself. Now, if I felt comfortable being in front of a computer, being able to look at my phone with glasses, maybe I'd venture to look at some of the other lens technologies because they still provide great vision after cataract surgery. But for me, if someone were to ask me tomorrow, I'd say the multifocal lens.